Well, the rise of the Delta coronavirus variant is causing concern for health officials all over the country and here in Maryland. And now some leaders nationwide are considering reinstating certain precautions. Joining us this morning with more is Associate Professor of Biology at Loyola University, Dr. Christopher Thompson. Good morning. Thanks so much for joining us today.
Good morning. Thank you for having me back.
You're so welcome. You have been with us every step of the way during the pandemic. Now we're seeing this continued rise in the Delta variant, but also a Lambda variant. Can you talk about both of those?
Sure. So all of these variants are just mutations in the original virus. And every time you have a mutation, there may be a slight change in how the virus works. So with Delta, we're seeing something that is much more transmissible. So, we see about 1,000, according to some studies, 1,000 times more virus in people's noses when they're infected. In some cases, we see more transmission, and it seems to grow faster. So instead of starting to feel sick around 5 days after getting exposed, it's about 3 days. So just a different type of virus. Lambda is a newer one. And so the concern there is that our vaccines may not be as protective. So the vaccines might be down to, 30% protective, 40% protective, which is still good. That's pretty typical for the flu, but it's not what we're accustomed to. So we need to be a little careful with that one.
Absolutely. And of the people who are getting the Delta variant, a majority of them have been unvaccinated. Is that correct?
Absolutely right.
Okay, so when it comes to the vaccine, let's explain to people again, because I think there is a lot of confusion. We've done some stories in the news this week about people who are getting COVID who have been vaccinated. And then the question is, by some, I didn't think you could get COVID if you were vaccinated. That has never been the case.
Right. We talk about a 90% protection, which is amazing, but it's kind of like wearing a seatbelt. So if you wear a seatbelt in a car, you're drastically decreasing the chances of hospitalization or death in a car accident, but it can still happen. So the vaccine is very protective, but it's not some magic thing that will protect you. There's still breakthrough. And these breakthrough infections tend to happen in people who have compromised immune systems. So they're undergoing chemotherapy or they have some other disorder that's making their immune system not work quite as well as someone else's.
And health officials have been saying if you do get the vaccine and you do get COVID, your symptoms could be far less severe and keep you out of the hospital.
Absolutely. So all the vaccines we have show, a 90+ protection against hospitalization and death. That's remarkable. We've never seen something like that before. So we're talking about those symptomatic infections where the protection is not that 90%, but still it's 40, 50, 60% even with these variants. And that's just protection against symptomatic disease. So it's really, really a strong vaccine.
And people have been watching the numbers. They are going up across the country. They are ticking up slightly here in Maryland as well. So because of that, are you expecting any sort of mask mandates to return, say in our area even?
Yeah, so the percentages look like it's a huge jump, but you're going from 100 people to 200 people.
Right.
So it's the percentages can be misleading, but the numbers are ticking up. And so I'm still being extremely cautious with my family. I have a young kid who can't get vaccinated. So we mask indoors or in public indoors. I think we're probably going to start returning to that, especially with heading into the school season where we have a lot of kids who can't get vaccinated. We need to up our precaution level a bit.
And to that end, you talked about having a young child. Right now, those under 12 still can't be vaccinated. Are they're still talking midwinter possibly for that to change?
Yeah, that's what we're hoping. But then even once we have a vaccine ready to go, we still have people who are a little nervous about getting it. And I think the nervousness increases more and more as you talk about vaccinating younger and younger children. So we still have quite a few hurdles to overcome with this.
And COVID testing isn't mandatory everywhere. So just like those who can walk around with being asymptomatic, still, unless you are required to get tested for COVID, if you don't have symptoms, you may have it and not know it. And you may have been vaccinated already.
Absolutely. All that data is emerging and we're not testing nearly as much as we used to. So we just don't know the answer to that.
All right, still a lot of questions out there. Thank you so much for joining us as always. Really appreciate it.
Thank you so much. Stay safe.
Oh,